I had someone very close to me who passed away. It's probably about 12 years ago. And she was HIV positive, which she contracted HIV through the use of, using needles. And she was so ashamed that even though her HIV had not gone to full-blown AIDS, she could have lived, but she refused all medical treatment. We didn't know at all. And I remember sitting, in a nursing home with her, and it was crazy. It happened like a month. It just went from like here to there. And she was so ashamed that she didn't say anything. She didn't want her kids to know. She didn't want family to know. And ultimately, she died because she didn't want to seek treatment, not because of the actual disease. So when I got with Tapestry and I started seeing all the things available to people, but it's sad because people won't utilize that stuff if they go into those settings and they're not being treated like humans.
I don't like being judged. It's to the point where I don't even like to tell my primary care that I'm using because I fear they judge me and then I won't get the appropriate help that I need help for. Same with my psychiatrist, my med provider. It's like I want to be totally honest, but yet I can't be totally honest because I won't get the help I need to get help. And I'll get judged for it and then I have to suffer the consequences.
How has your perspective or your awareness of stigma, has your perspective shifted at all? I know mine has.
So I have learned a lot, and this has been a very eye-opening experience for me to be with Tapestry. I faced a lot of judgment from my peers and even family members questioning, what I was doing and why I thought this was important work. And, really, people even asking me, don't you feel like you're contributing to poor choices and deteriorates health of a community by doing, participating in these services? And there's a lot of resistance among healthcare providers to engage with clients who use drugs or who come into the hospital, intoxicated or high. I think there's oftentimes a sense that there are more important patients to take care of. To me, that signifies a tremendous gap.
We have historically been very stigmatizing and condescending, and still in pockets that can be the case. Even before they come to me in the emergency department, they may have experienced different slights and stigma and bias, so that even though I'm approaching them for the first time, already their guard is up.
To me, as a healthcare provider, it makes me super aware of the gap that exists within our healthcare system on the part of our providers. And it pains me to say it, but we do carry a stigma. Nurses, doctors, we're all human beings. We have prejudged notions, we have preconceived ideas, we have them. But when we allow them to take precedence in our relationships with our patients, we do them a disservice.
Up until 5 or 6 years ago, we really didn't consider it was our role to treat opioid use disorder and other addiction in the emergency department. We felt like many people felt it was someone's personal choice, and our job was to make sure that you survived the overdose or you got treated for the abscess, and that was about it. And I think it gets to the larger role of the shift of I am just treating the problem you come in with, to recognizing that the problem you come in with is in part formed by the larger issues in your life. And if I don't address those, if I don't address your substance use, if I don't address your homelessness, if I don't address these other issues, then I'm never going to truly kind of treat the reason that you're here. And so as healthcare providers, we have to re-earn that trust.
That's what stigma does. It sets up a barrier. And it doesn't allow for us to be able to interact in a meaningful way. It doesn't allow us for us to fully empathize with our patients and try to understand their point of reference and where they're coming from. And I see that in healthcare, and it needs to change.
It's crazy to like sit back and listen to the way people speak about addiction, and it pisses me off so bad. And even like down to like yeah, people and their like dirty needles, and it's like they are not dirty, they are used. Like it's just, language is so important. Language is super important. So something just as simple as that.
The terminology that we use for people who use drugs or people who choose to use substances is definitely a consideration that we need to make. Much like rather than saying committed suicide, we are now trying to say died by suicide, because it's a much less negative connotation for a very, very sad situation. We have terms for people who use drugs like addict or junkie, or so many terms that have a negative connotation to them, that it only enhances the stigma.
By using non-stigmatizing language and building up trust again in the healthcare system, we can make it so that people feel comfortable coming to us.
I always like to think about it like, in order to normalize it and humanize it, we always want to humanize the person, right? So I always put a person before any behavior. So you're a person that uses drugs, like you said before, person that died by suicide, person that does sex work. So it's the person before the behavior, and that's how we humanize folks.
Yeah.
Is we emphasize their humanity.